Good afternoon and welcome. My name is Dr. Joan Reed. I'm Dean for Diversity and Community Partnership and Professor of Medicine at Harvard Medical School and Professor in the Department of Social and Behavioral Sciences at the Harvard T.H. Chan School of Public Health. I'm also Director of both the Commonwealth Fund Fellowship in Minority Health Policy at Harvard University and the Joseph L. Henry Oral Health Fellowship in Minority Health Policy. And I want to thank you for joining us for this informational webinar about the Joseph L. Henry Oral Health Fellowship in Minority Health Policy. Before we begin, there are a few housekeeping items for this webinar. A recording will be made and available on our DICP, Diversity, Inclusion, and Community Partnership website at Harvard Medical School. All lines will be muted and a chat is not going to be available. However, you can submit your questions using the Q&A function within this webinar. The program this afternoon includes an overview of the fellowship and the application process. And this will be followed by current and alumni fellows sharing their experiences as speakers here in this webinar, and then a short video that will show and feature additional alumni fellows. And at the end, there will be a Q&A session and an opportunity for you to ask any questions. Our speakers for this afternoon include Drs. Buchanan, Joffrey, and Rosenthal. One is a current oral health fellow and two are alumni fellows. But first, I'd like to begin with an overview of the program. There are three fellowship goals to our Oral Health Policy Fellowship, and one is around developing leaders, particularly leaders from groups who have been historically underrepresented in medicine and dentistry, and who wish to pursue careers in policy, public health practice, and academia, individuals who want to be change agents. It's also to prepare oral health leaders who will improve the capacity of our healthcare system to serve and address the needs of marginalized populations, and then to support the continued development of our fellows as they move forward in their careers. Next slide, please. A little bit about the history. The oral health program was initiated in 2001, initially with support from HRSA, part of DHHS, and the California Endowment, and in 2005 was renamed the Joseph L. Henry Oral Health Fellowship in Minority Health Policy, really in honor of and to continue the legacy of Dr. Henry by providing resources for the next generation of leaders in minority health and minority health policy. Next slide. Something about the fellows and their accomplishments. To date, there have been 14 oral health fellows. 16 are currently in the private sector, 21 in academia, and 14% in the public sector. But the majority, close to 80%, serve on committees at the local or state levels or national levels. They've received honors and published their work, more than a third. But all of them are engaged in policy, research, and service delivery for vulnerable, marginalized populations. Next slide. In terms of applying to the fellowship and eligibility, a DDS or DMD degree is required, and an active dental license is also required. We are also hoping for a minimum of 2 to 3 years experience in dental practice or the completion of a residency, and experience addressing the needs of and an awareness of the needs of for improving the health of minority, disadvantaged, vulnerable, and minority populations. A clear interest in minority health and health policy, public health, and U.S. citizenship or permanent residency is required. And the benefits include full tuition, health insurance, books, travel, and related program expenses, including financial assistance for practicum project. And probably the most important thing out of the fellowship is a network of amazing fellows during the fellowship and post-fellowship. Next slide. There are 2 degrees that are available, a Master of Public Health from the Harvard T.H. Chan School of Public Health, or an MPA from the Harvard Kennedy School. And for the School of Public Health, there are 2 fields of study in health management or in health policy, but there's cross-registration and you can take courses at any of our Harvard faculties. And during the 2022-23 year, I'm happy to say that the academic year will be in person after our years of dealing with COVID and hybrid. And there are course requirements for the degrees, the MPH or the MPA, and course requirements also for the fellowship. And as you might imagine, course requirements that are just foundational in terms of public health or health policy, biostats, epidemiology, economics and finance, but also particularly courses that are around leadership and minority health, decision analysis, issues around health quality and health equity. Next slide, please. There's also multiple other fellowship activities, leadership forums, leadership skill development. There's a seminar series, journal club, op-ed writing workshops. There's a practicum that's required as part of the degree, but a practicum that's also required as part of the fellowship. It's one practicum that counts for both. Mentoring offered by other alumni fellows, by Harvard faculty, and by members of the larger public health and health policy community and leaders. Group meetings and individual meetings with myself and other members of our staff. Most fellows attend national conferences. It might be APHA or Academy Health. There's a special program we have with leaders from the MGB, Mass General Brigham system, in terms of understanding better the operations of systems and how to create change and advance in health systems. Site visits that are national and local that will turn back into in-person visits. They've been virtual for the past couple of years. Shadowing of national leaders. And then there's an annual meeting where fellows present their work, but also alumni fellows return an opportunity for the family of fellows to come together. Next slide. So in terms of the activities, it's really around building your own personal narrative. This is about your story, your journey, and what you want to accomplish, expanding your networks, and starting to understand how systems function and how you could start to leverage and change systems, connecting you with leadership across the country, and alumni connections. I keep coming back to the fellow family and those connections that will be with you for a long time on completing the program. Next slide. The deadline for application is December 1st of this year, and it requires 2 applications, one to the Oral Health Fellowship and a separate application to either the School of Public Health, the T.H. Chan School of Public Health, if going for an MPH, or to the Kennedy School if going for the MPA. Those who are going for the MPA, to be eligible for the Oral Health Fellowship, already have to have completed an MPH. So that option is only available if someone already has an MPH, but there are 2 applications that are required. Next slide. In terms of the career paths, the fellows have been absolutely amazing, and you're going to hear from a total of 6, 3 in person through this webinar and 3 through a video, but you can see some of the things that they've done, from being in practice, working with the National Dental Association, working with children's hospitals, working with CDC, really across the board in multiple sectors, and those who are in practice, practicing in ways that are about equity and about justice and about providing access to individuals, a deep and big part of the work that all of the fellows are engaged in. Next slide. And so you're going to hear from Zarita Buchanan, who is one of our current fellows, our current oral health fellow, but she's also works with and is joined by Commonwealth fellows. So although these are separate fellowships, they operate together. It's one group together. They learn together. They participate in activities together. and stay connected as a cohort after the fellowship is over. But you can see the fellows come from multiple disciplines, from internal medicine, pediatrics, cardiology, family medicine, psychiatry, really across the board, very complementary. Next slide. And so I want to turn now to one of our first presenters for today, and it's Sarita Buchanan, a current Joe Henry Fellow. And so I'll turn this over to you, Dr. Buchanan.
Thank you, Dr. Reed. Good afternoon, everyone. My name is Dr. Sarita Buchanan. I am from Lithonia, Georgia, and I moved to Boston in July of this year to start the fellowship. This fellowship came at the right time in my life. I'd been in private practice. I'm a general dentist for the past 8 years. And I was interested in, I still am interested in diversifying the dental workforce. I work closely with a lot of minority college students who are interested in dentistry, allowing them to come into my office to shadow and gain exposure, but really helping them to become competitive applicants to apply to dental school. I've been doing this work since I moved back to Georgia after finishing UNC Chapel Hill for dental school. And I noticed that I could do a lot at the grassroots level, but there were a lot of other conversations regarding policy that I needed to have on a larger scale. And so that's why I applied for the fellowship. I am loving it, literally. It hasn't gotten cold in Boston yet, so I think maybe I'll have something different to say when it gets super cold, but I'm really loving it so far because I do feel like what Dr. Reed said, it's very much a family atmosphere. My co-fellows are phenomenal. They have really, welcomed me and shown me, a lot of them are from Boston, so they've shown me the area. I love the School of Public Health. I think when you've been out of school for some time and you come back to do rigorous coursework, it can be a little intimidating, but the School of Public Health has been amazing. It also is great to have a perspective, like a real world life work experience perspective when you take some of these courses, because you're able to see, oh, I see how that concept in epidemiology applied to, what I was seeing in my private practice. One of the skills that I really wanted to work on when I was here was writing. And I have been fortunate enough in some of the classes we're taking where they kind of lay out how to write a policy memo, how to write an op-ed. These were skills that I didn't get in dental school. So I think the fellowship and the program is not only giving me a great network of colleagues, but it's also giving me some tangible skills that I can use to further some of the passions that I have for the field of dentistry. So I highly recommend applying. I was a little nervous to leave private practice, to leave Atlanta, but this has been tremendous. It's a great opportunity.
Thank you. Thank you, Sarita. Our first alumni speaker is Dr. Alon Joffrey, class of 2010, who's an orthodontist at Dot Smiles Boston and Square Miles in Milton. An instructor in oral health policy and epidemiology at the Harvard School of Dental Medicine. Alon.
Hi, hi, it's good to be with all of you. So I want to take the opportunity to really just highlight for you guys some of the important aspects that I felt, I took away from the fellowship during my year. As Dr. Reed said, I completed in 2010. And for me, the fellowship was transformative. It was single-handedly the best academic year of my career. Having gone through college, dental school, and residency, I tell folks all the time that, that 1 year in the fellowship helped crystallize and tie together all of the various skills I'd learned in some of those other arenas, but it also helped me to crystallize what it is exactly I was hoping to do from a public health and from a, on a larger scale to impact change for underserved communities. And, I'm going to try and summarize it in 3 areas that I thought were really important and that I know that individually and personally and from a professional perspective, it has allowed me to be not just a better orthodontist and clinician, but a better leader and a better person who can push for change and push for things to be improved on individual care level, but also at the systems level. So I think advocacy is the first skill set that I was able to really hone in being a member of the fellowship and participating in the fellowship. Because what I realized is it allowed me to basically hone in those skills of being the voice for the voiceless and the vulnerable. And specifically, I was able to really get a good sense of how you can use policy as a tool to facilitate change. And so from a overall high level aspect, being able to really understand the advocacy component, I think the fellowship helped me to really highlight those skills. And then I was a person that my concentration was management. I think a lot of people focused on policy. And so that was unique for me. You know, I'm a small business owner practicing in private practice, but I'm also involved in local organizations, national organizations, regional organizations that are dealing with oral health care, whether it's in the specialty of orthodontics or just in general. And so being in the fellowship allowed me to really learn some important skills about managing teams and organizations. Because as I work for myself as a small business person, I have a team, and obviously we have an organization. But as I also volunteer in a lot of these organizations that are at the national, regional, and even local levels, they're also comprised of teams, and they also operate as organizations. And so that skill set of management and being able to, influence teams, motivate, inspire, a lot of those skill sets, I think, were honed being in the fellowship. And then the third component I would like to touch on is, using the advocacy, using the management, but tying it together to really be a better leader. And so I'm going to say leadership skills. I was able to learn and develop some strong and important principles that allowed me to be a better leader, specifically from a lot of the courses that we either at the School of Public Health or whether it was some of the seminars and some of the visiting folks that came to speak with us at various seminars. Also from some of the site visits, like I clearly and specifically remember using a lot of anecdotes, stories, strategies, tips that I learned in some of those fellowships. And, I'm able to incorporate those daily, not just here within the practice that I'm in, not just within those organizations, but just in a broader sense. So from a personal perspective and from a professional perspective, those skill sets that I learned being in the fellowship, I use them daily. They've made me a better person. They've made me a better orthodontist, and definitely a better leader for the organizations that I'm involved in. And then, I think I'll wrap it up by saying one of the things that I always try to encourage folks who are either exploring the fellowship or considering participating in it is to just think about what it is you want to do, and think of the skill sets that you're going to need to impact the change if you want to impact the change. That you want to see coming forward. And the fellowship, without a doubt, will allow you to hone those skills. Without a doubt, there are resources in that program that will allow you to just develop whatever it is that you think you're lacking or whatever it is you think that you want to focus on. And with that, I'm going to end because I think I only have about 4 or 5 minutes, and I'm just trying to cram a lot in there, but wholeheartedly recommend the fellowship. I think I'll close by saying, as I said in the beginning, for me, it was single-handedly the best year in my academic experience. And that's saying a lot, having gone through at least 13 to 14 other years from college to dental school to 2 residencies and then the fellowship.
Thank you. Thank you, Alon. Our second alumni speaker is Dr. Christina Rosenthal, class of 2015, and owner and CEO of Paradigm Dental Center, founder and president, the 516 Foundation in Memphis, Tennessee. Christina.
Thank you. Thank you, Dr. Reed. I just want to begin by stating the obvious, and I can't speak for everyone, but I know prior to applying for the fellowship, I was tired of clinical dentistry, and I knew that there was so much more that I was meant to do. And I had a nonprofit organization, didn't know what I was doing, but I started it. And I really applied to the fellowship because I needed more tools in my toolbox to really get it off the ground running. I will say that applying for the fellowship came with great sacrifice. I'm married, I have 3 children, I had a private practice. So I knew prior to coming that this would be a huge investment, not just for me, but for my entire family, my patients, my team, everyone. But I have no regrets. And in fact, I have to echo Elon in saying that it was the most fascinating, the most invigorating experience of my academic career. When I got to Harvard, I want to talk about how it benefited me or added value to my life. So I've always spoken to audiences, but I have a terrible fear of speaking. People never believe me when I say it, but it's true. And so when I got to the fellowship, I was asked to speak at an event that the Diversity and Inclusion Office holds every year for youth. And I'm thinking like, I've only been here a month and they're already asking me to speak. I'm terrified, but I was so grateful because I got an opportunity to do something that I was fearful of, but I knew that I could do well. And it also had youth involved. So I was able to see another program similar to mine in action. So that's benefit number 1. Benefit number 2 was just networking with my colleagues, and not just those fellows who were there with me, but others who had come before me. There was nothing I could ask for that was not available. All I had to do was like send out the back call, send out the email, and someone would connect me with someone who knew someone. You don't get that in a lot of circles. And the third thing I would like to say that was just so beneficial is, I don't know about you all, but sometimes even at 44, I have imposter syndrome. That's not something I like to admit, but it's my truth. And we would have dinner and we would have lunch with all of these world health leaders. And at first I was a little intimidated, but by the 3rd or 4th, I'm asking about your kids. I'm asking about how are you balancing your family life with your career. I got comfortable and I realized that I was chosen because I was meant to be there. And that alone has carried over into every space that I've entered since leaving the fellowship. And then the 4th thing is this fellowship was just like a fertile seed for all of the opportunities that have come after it. So after the fellowship, I was chosen to do a program called Presidential Leadership Scholars, and then Atlantic Fellows for Health Equity. And then I even formed a speaking company from my fear called Prescribing Inspiration. But you know who I have to thank or what I have to thank? It's the fellowship, because it laid the foundation for all of those future opportunities. So just like Zarita and Elon, highly, highly recommend it. And I know that for some of you, it will be a sacrifice. That goes without saying, but you can't, it's that cliche, right? Anything worth having, you have to give something up for it. And I didn't say that the way it's normally said, but you get what I'm saying? You have to give up something in order to get something greater. And so I would encourage you, don't let the fear of finances, don't let the fear of imposter syndrome stop you from applying, because in life, it all works out. It always works out.
Thank you. Thank you, Christina. And now you'll have an opportunity to hear from 3 additional alumni, Dr. Swan, Sprott, and Stevens, through a short video, and then we'll come back for more Q&A.
Hello, my name is Dr. Brian Swan, and I am a Joseph Henry Fellow. And one of the things that this fellowship at the Harvard School of Public Health, through the Harvard Medical School, and under the mentorship of Dr. Joan Reed, who I'm proud to say is still a mentor of mine. I came into a situation at age 58, so I'm the oldest fellow, to learn about policy and advocacy and research and the significance of it. This is what the School of Public Health at Harvard and the degree of an MPH and being a member of the Reed Scholars in Minority Health Policy. This is what they gave me the tools for, to be able to investigate, to advocate, and to be a part of the team of people who are trying to make a positive difference.
The Joseph Henry Oral Health Fellowship armed me with the confidence and skills that I needed to seek out and pursue opportunities that veered a little off the traditional career path that comes to mind when one thinks about dentistry. My experiences, as well as the exposure that I gained through the fellowship, helped to guide me as I made a pivot away from full-time clinical practice and led me to the role that I have today. We are truly challenged to think about our own biases and what that may look like, not only as a clinician, but also as a public health leader. Ultimately, I think that our fellowship challenges the fundamental way in which we think. It forces us to recognize our limitations within systems that were not designed for us to thrive, and teaches us how to become visible within those systems.
Hi, my name is Dr. Wayne Stevens, and I'm the current Joseph L. Henry Oral Health Fellow. As part of my fellowship, I am studying for an MPH degree in health policy. And this fellowship has been an incredible opportunity for me to learn from very high-level leaders who are crafting everyday health policies that affect us and our patients, and more importantly, our communities. But in addition to being in an MPH program, the fellowship offers a ton of resources and support, and also a connection to a network of other fellows and leaders who are very instrumental in health policy that will really help you to get further along in your career of being a leader in minority health policy.
This particular program equips you to go into the battlefield, more or less, and make a positive difference with data, with the language that you understand, and the support and the passion that comes from all of us to pay it forward for the people that we need to serve.
So I invite you to consider applying for the Joseph Henry Oral Health Fellowship at Harvard University. We want you. If you're interested in further developing your leadership skills among minority and vulnerable populations, this fellowship is for you. Join us.
Great. So you've heard from 6 of the fellows, and you understand why I say they are all amazing individuals and clinicians and leaders. It's a time now for questions. Any questions that you might have, please add them to the Q&A on the bottom of your screen. But I have a question that I'll just put out for any of you in terms of adjusting coming back to school, because everyone has been out for a period of time. And was that difficult? Were there resources available to help you in that transition?
I can start. There definitely were resources, or are resources available. And at first, I think I was very intimidated. We started our summer semester with biostatistics, and I had never taken that. I'd been out of school for 8 years. But one of the best pieces of advice that my dad actually gave to me when I started dental school is you can't go through dental school alone. And I don't think you can go through this fellowship alone either. You have to lean on the support of your co-fellows. And there's tutors available. I think, even the other classmates that you meet in the larger program are willing to sit down and work with you. So if you isolate, I think it can be challenging, but the environment is very welcoming to collaborate and do the work together. And the teachers are all very accessible as well. They hold office hours all of the time. So if you have questions, you're always able to ask. But I definitely think, the resources are there to allow you to complete the work.
Could you speak a little bit, because some people might have questions, they want to speak further about the program or to have questions. Can you speak about the accessibility of alums and fellows and being available to talk to people about what I would call their dreams and the program? And I know, just like we called on you for this, but I think you also called on other alums at other times, but to talk a little bit about that, because sometimes there's a hesitancy. Maybe Christina or Alon, you could talk about that.
I'll let you start, Christina.
Oh, okay. So I would just say that the culture of the fellowship is to be supportive of one another. And I don't believe that there has ever been a time that I have sent an email, and if they were busy, they would just simply reply, you know, I'm a little caught up at the moment, but I'll reply as soon as I can. But it's very, very welcoming, as Zarita said, and all of the fellows, there's a culture of, you know, helping one another and being there and assisting and being available to ask questions or take a quick 5-minute phone call or Zoom call. That's been my experience.
Similarly, I think for me, whenever I reach out to someone from the fellowship or any member who, whether I knew them from my cohort or just got to know them from being an alum, folks have always been very receptive, very welcoming, and very helpful. I think it's almost like a secret password, right? You're like, I'm a former fellow. And it's like saying that alone opens up access to individuals and resources that you probably wouldn't have had. And so from my perspective, I think, you know, it's a huge network. It's a very experienced network, and definitely use the resources that the network has and that you will have access to through that network. But there's, you know, that's just, it's like an added bonus, right?
One of the things that I'm sometimes asked is, and I alluded to it, I said that the fellowships, although they're two separate fellowships, the Joseph Henry and the Commonwealth, that you learn together as one. And maybe you could speak to that, because it's not the norm for dentists and physicians to train together, even though we do talk about interprofessional, but this is really training together. Maybe you could speak to that.
I'm happy to speak to it from my perspective. You know, there are two theoretic, like on paper, there are two separate fellowships, but you go through the experience as one, really. And so I think the only time I ever was required to even stop and think that, wow, I'm in a different fellowship in terms of the title was, you know, when I had to speak to things in the oral health setting. But normally it's just, we're all there as one cohort, one team. I really enjoyed it. I was very close with my cohort, still am to this day. Just had dinner with one of them last week or 2 weeks ago. And it's important, right? It's the camaraderie that you develop. It's being able to go through challenging times together. You really become like a family. At least when I did it, I spent more time with my cohort than I did with my actual family. Like way more time with my cohort than I did with my family. And it was phenomenal. It was great that we had each other to lean on, and it was great that we had each other to support, whether it was academics or social or professional. And so I'm sure others have things that they can add to that.
One of the things, and maybe a way to get at some of the ways we work together, is one of the questions that came in was just, can you talk a little bit about what does the day-to-day look like, our schedule? What does it look like to be in the program?
So there are 3 different semesters. We started with the summer semester where we took, I think, 10 credits. So it was 2 larger classes, epidemiology and biostatistics, and they meet like 3 days a week. And then we had some seminar activities, and we took a smaller 1 credit class. So your day is not 8 to 5 classes. I like that a lot too. It's like you'll have, a morning class and then maybe an afternoon class, and you'll have some fellowship activities in between. So it's a nice mix. Right now we just started fall 2, so we have some new courses coming up, but my entire cohort is all health policy. So all of our classes were together. Next semester, I think we'll have some electives that we participate in, but your day is not like you would think in dental school. It's a little more reasonable. So it's manageable, the day-to-day activities.
And sometimes when potential fellows ask me about the fellowship, they always say, am I able to work? Well, the fellowship is very busy. And unfortunately for you, there are a lot of online opportunities, but really your commitment should be to the fellowship. I owned a private practice back home, so there were some managerial things that I was doing remotely. However, my first and number one priority was my courses and fellowship activities.
So, and so I just want to underscore part of that the fellowship is a year. You're getting a degree within a year in the fellowship, but it's also an opportunity that most of us have not had in our career for self-reflection, to sort of think about where I am, where do I want to go, what are my values, what do I want to accomplish, what are the decisions I need to make and to weigh. And most of us don't have, I'm going to call it a luxury of having a year to really think about it and think about ourselves. And so to take full advantage of the fellowship, as opposed to being so booked that you don't have time to attend or to get the full benefits from the program. So I think it's impossible to work full time and do the fellowship. That's absolutely impossible. But it's also a program that's in person, and it's important to be present for some of the things you heard were sometimes there's dinners, there's lunches, there's special meetings. Sometimes and we try to plan them all beforehand, but sometimes a leader is in town and says, I'll meet with fellows now, and we'll contact people and say, there's a meeting coming up. Would you like to meet? And so it's being available. I would also say, though, that fellows, and you heard this, oftentimes have family. And so it's not that they have to ignore their families or leave their families. And in many ways, the other fellows know the family members over time. And so it does work out. There's questions here about, it says sort of prerequisite or ways, or you were involved. Maybe each of you could speak briefly around, could be health disparities, diversity, health inequalities prior to the fellowship. Because we say we're looking for individuals who have been in this space in some way or other, but maybe you could each give you've talked about what you've done since the fellowship, but maybe a little bit about what you did before.
So prior to the fellowship, I started a nonprofit with the primary program being a pipeline program to encourage students who come from disadvantaged populations to go into healthcare careers. So that was the primary work that I did, other than being in clinical practice.
So before I came to the fellowship, I was assistant director of a program called Increasing Diversity in Dentistry. And we are a national organization that was birthed out of the Atlanta University Center, so Spelman and Morehouse College, working with students at HBCUs across the nation who are interested in dentistry, basically exposing them to clinical dentistry, but also giving them like DAT prep, networking opportunities, taking them to tour different dental schools. We know that like the journey to dental school is hard for a lot of people, and a lot of minority students sometimes have unique circumstances that make the journey even harder. So the goal of the organization is to really eliminate some of those barriers, either financially or just exposure-wise, to allow students to apply and be confident when they do apply.
My path was similar, but a little different in that I didn't have a special role or organization that I was involved with, that I had as a personal project that I was passionate about. think I just knew that I was passionate about working in underserved communities. And so I worked with an organization that had facilities in multiple cities across Massachusetts, and the organization was geared towards treating patients within those cities. And the cities were chosen based on socioeconomics, and oftentimes it was tied to other things such as race and ethnicity. And so being a part of that organization, being a provider within that organization, it allowed me to get a bird's eye view into those communities and to get a sense as to how care was being delivered, and to see how organizations were approaching those communities and approaching how they were going to interact with those communities and the priorities that they had set for those communities, which oftentimes, quite frankly, weren't aligned with the priorities the communities had set for themselves. And so being in that role, it just gave me the sense of, okay, there's a lot going on here. There's a lot for me to unpack, and I don't have the tools to unpack it properly, and I certainly don't have the tools to formulate, potential solutions. And so that was the genesis for my journey. And so based on that, I, started looking into ways to first go about just getting I'd known about the fellowship, but I basically started really thinking about applying to the fellowship and looking to become better equipped to, like I said earlier, be a voice for the voiceless and help those who are most vulnerable. But also to be a part of a community too, right? Because you don't participate in the fellowship and then operate in a silo. You're a part of the community, and that was important to me, still is.
They're looking at some of the questions and going to combine them a little bit, because one of the questions is, I haven't had necessary opportunities to lead. So what does that mean? And I think part of what you heard in the responses here are the fellowship is not looking for people who've been CEOs necessarily. It's individuals who've acted, who've not just said words, but then have acted on those words, who have put themselves in positions so that they're better informed, so that they're serving others, that they are putting things in place to create change, and they want to be better at it. So it's not that you've had to already won the prize to apply for the fellowship. It's really about attitude and intent and actions that you've taken in the past that we're looking for. But from all three, you heard this commitment or work around marginalized or vulnerable populations that brought them to the fellowship, but that's where the experience was. There's a question here about what do you do on finishing the program? Some of you talked a little bit about it, but maybe you can also speak to the issue, because sometimes people will say, do I have to leave clinical practice? And people have not left clinical practice, although some have. And they've taken a different course, and maybe speak to that. I will say, as the director, the program has no preconceived notion of what the right path is. There is not a right outcome for a fellow, other than to use the tools that have been gathered to help make a difference, to help create change, and to understand that to be servant leaders, that this is not necessarily about them per se, but about those that they'll be able to help. But maybe you can speak to that, because it is a question people ask oftentimes.
I hope I'm not, I feel like I'm speaking a lot now, but you talk about, I feel like that question came to me because I'm still in clinical practice. And for those who don't know, I'm an orthodontist. And so, when I was in the program, a lot of people were like, orthodontist, why are you here? It doesn't make sense. You're dealing with braces, you're straightening people's teeth. Like, folks don't even have real problems. Like, someone else should be here. And so I had to really work to explain to individuals why it was important for me to be there. And as a clinician in my own practice, but also, I'm sure I teach as well part-time. And then I also work in another hospital setting. I enjoy clinical orthodontics. I enjoy clinical practice. It's where my heart and soul is. But as I'm having an impact on individuals, I'm also putting myself in position through my volunteer work and through my involvement with other organizations to have an impact on populations and systems. And so I sit on at least 3 or 4 boards of local and national organizations that are impacting oral health. I sit on boards that are not directly involved with oral health, but also but because of my experience with the fellowship, I'm able to bring a lot of the same concepts and thoughts that were honed in the fellowship, help make those organizations better. And it's always around equity and access and inclusion. And so for me, picking back on Dr. Reed's point, it's about utilizing the tools that I developed in the fellowship to make sure that I'm being impactful and action-oriented in the environments that I'm currently in. And that can be whether I'm in my clinical practice within my individual office, whether I'm at the hospital system that I'm in, whether I'm teaching, or any of the organizations or boards that I volunteer and serve in. So that's how I utilize the tools, and that's where I find my sweet spot for impact.
I'm gonna to say something because I'm also looking at the time, and the other part I would say is the fellows evolve, and it's wonderful to watch. Life changes, families change, interests change, new opportunities arise. And so part of what you're hearing is what fellows are doing as they leave the fellowship or what they're doing now. And they may continue to do this, but they also may go in other directions. The other part, this is oral health policy, and all of them have been, in the career that they've chosen, deeply committed to oral health, but they are not coming out of the fellowship as oral health leaders. They're coming out as health leaders that can span the full spectrum in terms of health and health disparities. And I think that's an important point. They bring a perspective and an understanding that is unique, that also helps other fellows who are physicians to have a whole different kind of awareness than they would normally have. But Joseph Henry Fellow and alumni are health leaders across the board. I want to thank Zarita and Christina and Alon for joining us today. Thank all of you for joining us for this session, and apply. Bye-bye.